There are really two primary changes that can occur in memory and thinking as we age that we would consider normal. The first is some word finding difficulty or a slowness in retrieval of words that a person knows. Typically this would be the name of an item, what something's called, or the name of a person or a place. The other common change that can occur in cognitive functioning is a slower processing of information in general. And this is seen when a person is learning or encoding new information. A system changes in the home, like a cable or a TV system. It may take them a bit longer than it would have in the past. There are many medical conditions that can affect our memory and cognitive functioning. In older individuals, one of the first things that we want to look for is the presence of infection in the body. And in particular in older adults, urinary tract infections are to blame for a pretty rapid change in memory and thinking abilities. People with diabetes, if a person is having spikes and highs and lows in their blood glucose levels, that can really affect cognitive functioning. There's also the question of medications that can affect brain function. There's certainly various ones that can, but the ones that I see most commonly are either over-the-counter sleep aids or prescribed medications for bladder control, because some of them do have adverse effects on memory and some of them can cause trouble with balance as well and cause falls. Depression, anxiety, even just significant levels of stress can also really affect attention and concentration, and can make a person feel like they're having a memory problem as a result of that. So a lot of times people will come for an evaluation thinking that they must have early onset dementia or early stages of dementia, and we'll find out that actually their depression, which may or may not be treated, or their stress level is really what's impacting their cognitive functioning. The number one tip for maintaining brain health, optimal brain functioning as we age and at any age, is cardiovascular exercise. We think that it has to do with the increased supply of oxygen and nutrients to the brain, but there's been studies to show that not only does this reduce the risk of a person developing dementia, but it also helps improve cognitive functioning from wherever you're at now. The second is to engage regularly in activities that are mentally stimulating. The third thing that I talk a lot about with patients to help promote brain health is social interaction, because when we're regularly engaging with other people, it is stimulating our brain. But also it helps with mood. So it helps us to be less prone to depression and anxiety if we have regular social interactions. There are just so many different things that can affect our cognitive functioning beyond dementia, beyond the things we hear about most commonly, like Alzheimer's disease. There's so many other factors, many of them reversible. And so it's very important to take those concerns to your physician and to consider a full evaluation, because that's how we're really going to get the information we need to answer the question of what's going on and what the next steps are in your treatment.